So this discussion will cover a horizontal mattress, and there are several good indications to use a horizontal mattress. Oftentimes I would like to use this to sew a drain into place. Essentially this acts as a purse string around your drain, which is exiting from the midpoint of your incision. Additionally, you can have a drain that's coming from a separate location. If a trocar insertion was necessary, you would have it coming out in a separate area. You would essentially be making the same type of holes with regard to the suture to purse string that drain into place. And at the end of the lecture, we're going to talk about a figure of 8 that you will do around your drain. So my tubing here is going to act as if it is my drain. Now, other indications for a horizontal mattress, this is very good if you have someone who's oozing just a little bit more, and it does allow for some hemostasis in that area. It also will well evert the wound edges. So always when we start a horizontal mattress, we will enter the skin on the contralateral side away from us, and then exit the skin closest to us. This is one of those times when you're going to be operating away from you. You're going to turn the needle around, go back into the patient, come back out of the patient. What you will see is then the knot tied away from you and one string of the suture material being proximal to you. So again, just like you would do a simple interrupted, you have picked the needle for the reason. Please use it in a perpendicular fashion. Use your wrist to go through the patient. Grab your needle and readjust your needle driver. Now you will want to use and leave more of the suture material away from you because this is going to help with that figure of 8 formation around your drain. Go back in on the side closest to you, come back out. Again, this is very similar to that simple interrupted suture that you're going to place, except now we're going to actually turn the needle around. Again, I'm demonstrating this right-handed for you, as most of you are right-handed, except for me. Pull it all the way down. Again, similar to just a simple interrupted here, except now we're going to step over and we're going to throw our wrist away from us, okay? You're still going to go over approximately 5 millimeters. Oftentimes it's directly related to the type of drain. If you're doing this not from a hemostatic standpoint, but from a drain standpoint, it's directly related to the drain that you selected for the patient. Again, grab your needle. Pick up your tissue. Enter at the same level that you exited out on the side closest to you. Rotate your wrist. This should not be action within the shoulder itself. Grab the end of your needle. Now, you cannot at this point just simply start tying this around the drain. You need to actually secure it to the skin. So the reason why we do this around a drain itself is to ensure that as the patient is being transferred from the operating room to the recovery room, or if this person is leaving the hospital with that drain in place, that the only person who takes this drain out is you, that it does not get inadvertently removed too early and places the patient at risk for a seroma formation. Now, if this was your tubing, and this was your tube either coming out of the wound itself or out of an adjacent area as you used a trocar to place the drain itself, oftentimes you'll have a tech, someone will actually hold the drain tube up for you, but for the purposes today we don't have that, so I want to demonstrate that figure of 8. So you have created your suture, essentially it is nicely in place, your drain will be inside the patient, and what you're going to do is simply cross your fingers, okay? Take the suture around the drain and just crisscross. Again, it's a figure of 8, but essentially it is that crisscross pattern that you're going to see on the tubing itself. Oftentimes you'll see the surgeons or the PAs snug this down And then what you need to do here, and this is why you need more of your suture material, because you still need to place an additional tie, okay? So we still need to have enough material for either a single or a two-handed tie around the end of our drain. I'm struggling a little bit here. I need someone to hold that drain in place for me. And again, similar to when you are sewing your patient back together, you want to complete about 5 or 6 hitches, okay? The whole point is that you don't want this to pull out too soon. And then, just as you would cut your regular suture, leave a little bit of higher tail on this. And this basically, now you can see if I pull this drain tubing up, I'm going to pull on the patient. And that's the goal, is not only is the suture secure at the patient site, but you've done a figure of 8 looped around the drain itself. Then you've tied an additional knot here to ensure that no one else is taking this out until I do so. Now the way to remove a horizontal mattress, whether you're doing it for drain removal or whether you're doing it, you do this suture for a hemostatic standpoint, you actually want to cut on the side that has the simple line, because that ensures that you're pulling less debris through the wound, and it actually is much easier in terms of removal for your patient. So you take your suture scissors, again you have your nice groove there, just going to lift that suture material up, slide right underneath, and that allows me to pull everything out as I pull essentially in line with how the suture was placed underneath the patient. We'll be walking through this in lab next week.